I'm Cecilia. I'm your nurse today. So what are you here for?
I was recently, about a couple weeks ago, in a car accident, and I went to the hospital right after, and everything seemed fine. I just thought I was really sore and bruised everywhere. And then after like a week went by, I just noticed some really sharp pain in my spleen, and it's also like bruised too.
Oh.
So I just wanted to come in and get it checked out.
So we're just going to do a brief abdominal assessment on you.
Okay.
Check things out. I'm just going to pull this up here a little bit. Alright, so we're going to inspect. You see your bruise there. Everything else looks pretty normal though. So we're just going to listen now. Too much sound heard, which means that there could be a problem. So we're just gonna palpate. Just tell me if you feel any pain.
Yeah, there's some pain up there where the bruise is.
Okay. I'm just gonna press. Does that make a tender here? Do you feel a lot of pain?
Mm-hmm.
Okay. Because usually you can't feel the spleen, and yours feels a little swollen. Based on our assessment, I think it'd be best if you went to the emergency room to get further testing done, because your spleen is a very vital organ, and if something were to happen, you could be in serious trouble.
I'll make sure I head to the emergency room right now.
The main function of the spleen is to act as a filter for purifying the blood, removing microbes and worn out or damaged red blood cells. It is also an important organ in the immune system, producing the white blood cells that fight infection and synthesize antibodies. Abdominal trauma is an injury to the abdomen. It may be blunt or penetrating and may involve damage to the abdominal organs. Abdominal trauma is caused from either blunt or penetrating accidents. The most common accidents that lead to abdominal trauma include car accidents, sports injuries, falls, gunshots, stab wounds, and so on. Normally, a patient should have no pain when assessing the abdomen while percussing and palpating. It should be symmetrical with no masses. The spleen should also not be palpable. When auscultating, there should be sounds of digestion in the abdomen. When there is trauma to the abdomen, there will be abdominal pain, tenderness, distension, or rigidity to the touch. The vowel sounds can also be diminished or absent. The patient may also be abdominal guarding, which is tensing of the abdominal wall muscles to guard inflamed organs within the abdomen. A spleen injury is confirmed with a CT scan. One of the treatments for spleen injuries is a blood transfusion. If the damage to the spleen is severe enough, surgery may also be an option.
So I went to the ER and they were able to give me a blood transfusion, and after that they also gave me some medication, and the bruise is gone and the swelling is also decreased. There's still a little pain, but they said with the medication and the blood transfusion that it should be gone. So I got back from the ER and they gave me a blood transfusion and some medications, and they said that the swelling should be going down and the bruise is gone. So yeah.
Okay, good, because after checking again, everything seems normal. We can hear the vowel sounds again. So it's going the right way.